Dr. Tozzi here. Are your teeth cracked, chipped, broken, busted, or just an overall eyesore? Well, I'm glad you're here with me today because we're gonna be talking about how to transform that smile into the one of your dreams using veneers. If you aren't sure what veneers are, they're actually thin porcelain jackets that go over the front surfaces of your teeth. If you're considering this type of treatment, what I would first tell you is to do your research. Look your dentist up that you're kind of thinking about going to. You want to see their portfolio, you want to see their work. While we're talking about veneers, let's talk about the three most common types out there. You've got feldspathic porcelain. It's beautiful, beautiful, beautiful. It's pure porcelain, probably the most aesthetic in my opinion, but it's also very fragile. It's glass in your mouth. So think about all the things you do with your teeth. You really have to be careful with these beauties. Second type is EMAX. It's a newer material that's out there. It's just a stronger type of porcelain. It can be very aesthetic. However, in my opinion, feldspathic is still my favorite, but this is probably the type of material that's most practical for most of your patients. You get that strength, you do get some beauty with it. Third type, composite veneers. It's what some people kind of think of white bonding material. They're great, they're not necessarily long-term, and they do have their limitations. If they're not done properly, you will not get a long time out of them. What happens is the composite around the margins or around the edges, it can start to stain and look really unsightly. So if you're gonna go this route, it's less expensive, but just make sure that you're going to somebody who really knows how to do these well. So when a client comes to me and they say, I want porcelain veneers. All right, well, what are the steps? Well, we do initial consultation, we gather some photos. It's just kind of a data collecting appointment. Get some x-rays, discuss a patient's goals. That's all really important in designing a patient's custom smile. Visit 2 is we actually prepare the teeth and you leave in your temporary veneers. 2 to 3 weeks later, you come back, we take off the temporary veneers and we go ahead and try in the permanent veneers. Make sure that you absolutely love them. If it's a go, then we go ahead and cement them and you're on your way. So about 2 to 3 appointments over 3 to 4 weeks is about all it takes. Probably one of the most common questions I get asked about veneers. Do they break? Well, what kind are you getting? If you're getting the original feldspathic porcelain veneers, yes, you have to be careful. That means not opening baggies with them. We don't use them as tools. If you're getting something a little bit stronger like EMAX, you have a little bit more wiggle room and strength there. It's an investment in your smile and you gotta protect it. You gotta be careful. Should you get veneers? I don't know. Maybe you're trying to get that new hottest next best thing out there and maybe you're kind of tipping age 50. Maybe you do want to invest in kind of upping your game a little bit with a new smile. It's really an anti-aging thing. In my opinion, I think it takes more years off than a facelift, but you know, maybe I'm just a little bit partial. If it makes you feel good, do it. Just make sure you go to somebody who knows what they're doing. That's the key. Are you looking for more health and beauty tips? Be sure to subscribe, like, and follow me at Dr. Michaela Tozzi on Instagram. Until next time, toodles.